If you've ever Googled the cost of eyelid surgery, you've seen numbers ranging from $3,000 to $30,000. Same procedure, wildly different prices. By the end of this video, I'm going to simplify blepharoplasty pricing, what you should actually care about, and yes, I'm going to cover surgery in Turkey too. And stick around because I've also got a bonus tip at the end, one question you should ask any surgeon before you book that works in any city at any price point. I'm Dr. Kian Eftekhari, Oculofacial plastic surgeon at the Eyelid Center of Utah. My entire practice is the eyelid area. And when patients come in confused by different prices, I get it. But in this video, I'm going to simplify it. Okay, first thing, when you see something like $5,000 for an upper eyelid lift, that's typically the surgeon's fee only. It's what the surgeon charges for their time and their skill. But that might not be the total. Think about it like buying a plane ticket on Frontier or JetBlue, where you're only being shown the base cost, but you're not flying anywhere until you also pay for a specific seat, and then your checked bag, or some airlines even charge for a carry-on, and then the taxes and the fuel fees. In eyelid surgery, there are costs that don't really go to the surgeon, but they go to something called the facility fee and the anesthesia fee. Those are everything else that has to come together for a real surgery to happen. Think of the facility fee like renting the operating room by the hour. You get a beautiful operating room, the bed for the procedure, all the equipment the surgeon needs, and a staff to take care of you before, during, and after surgery. The anesthesia fee is similar, except that it goes to the anesthesia provider who's taking care of you while you're asleep. And depending on your case, those extras can add up, but it's important to take that into account when you're planning an elective surgery. And if this is a surgery that you're thinking about, you're welcome to contact my practice to understand just how it works. Just go to eyelid.pro/book. Okay, so let's talk actual pricing. Upper blepharoplasty, just the upper eyelids, usually runs from $4,000 to $10,000. Lower blepharoplasty is more involved. Fat repositioning, sometimes a different surgical approach like fat transfer, sometimes skin tightening on top with a laser. Most of the time, this is going to land between $6,000 and $10,000. A forehead lift is going to be anywhere from $5,000 to $12,000 on top of the above. Now, in some places, like right here in my area, the University of Utah Hospital actually posts their pricing publicly online. You can see that here. Upper blepharoplasty, $5,400. Lower blepharoplasty, $5,950. Brow lift, $5,000 to $8,000. That effort at transparency is really nice. I like that. But don't be consumed just by the dollar amount because it doesn't tell the whole picture. At a university hospital, there are other doctors in the room, not just the one that you met in the clinic. There are residents and fellow doctors who are in training. That's not automatically a problem. Teaching programs produce excellent surgeons, but it's something you should know going in. There's going to be a hierarchy in the operating room, and probably every member of the team is going to get to do some part of something involving your care. You might get a great outcome, but you might also have someone who is learning the skill who is actually doing your surgery. It's the same thing with going abroad. You might get the real doctor you've heard of, or you might get the ghost surgeon who you've never actually met that does your procedure. You just got to decide which is right for you. So if there's one part of this I want you to understand, it's this part right here. This is the part where putting a price online just doesn't capture what's actually happening under the hood, and honestly, it's the most important part of this conversation. Price and experience are correlated, meaning in general, the more experienced the surgeon, the higher the price. This is not a perfect correlation, but it is more so than people realize. I'll tell you something I usually don't lead with. When I was early in my career, I charged a lot less. That's just how it works. You're newer, you're building your reputation, you haven't yet developed the kind of practice where patients are willing to pay and wait to see you specifically. So when you see a surgeon charging significantly less than others in the same area, it's just worth wondering why. Could they be newer in practice, maybe less specialized, maybe just building up volume? Maybe they're bringing on a new, younger surgeon who's just trying to get busier. Now, could you get lucky and find someone who's highly experienced, great outcomes, and just charges less? Yes, it happens, but it is the exception. Great surgeons who run great practices and get great outcomes spend years of time, their own money, and they work really, really hard to get to that point. And so they often charge accordingly for that. And if you find a unicorn somehow that's excellent and experienced and cheap, I would want to see a lot of examples, a deep before and after portfolio, multiple case types before I sign on, because I really want to understand why that discrepancy exists. Because usually there is a reason. Here's the flip side of that though, and this is equally important. If you're in a market like, let's just say Los Angeles or New York, that correlation might break down. Those are expensive places to live. A rising tide lifts all boats. So when the cost of everything around you is high, rent, staff, facility fees. Even a less experienced or less specialized surgeon is probably going to charge a lot. So in an expensive market, a high price doesn't actually tell you quite as much. You have to do more homework. But here's a signal I actually pay attention to, and this might be a little counterintuitive. If a surgeon charges noticeably more than others in their same market, just think about what that means. That surgeon has a practice that stays fully booked even though their patients know full well they might be paying more than somebody down the street. Now, if a surgeon had bad outcomes and they charged high prices or charged a premium, then they probably wouldn't have a busy schedule. That's how supply and demand works. Word travels fast in our world, so a surgeon who consistently commands above market pricing in their own backyard, that usually signals something. It's not a guarantee, but it is a real signal. Okay, let's talk about Turkey. You've seen the ads, eyelid surgery for $2,000. Those prices are real. I'm not going to tell you they're not. I'm not going to say that good surgery doesn't happen abroad because it does sometimes. But there are 3 things I want you to think about before you book a flight. And don't get me wrong, Turkey is a beautiful place. I've been there. It's near where my family is from. You should go there, just maybe not for eyelid surgery. So first, when you're under anesthesia, you're asleep. You have no idea who is actually doing your surgery. Who is the surgeon? What is their training? Have you seen their actual results? Or have you just seen the one from the main doctor that are in the marketing photos? Second, what is your plan when something goes wrong? 2 weeks later, you're already home. Now, I'm not saying this to scare you. Complications happen with great surgeons too. But I wouldn't be saying this if I haven't experienced it myself. Patients walk into my clinic from after their surgery in Mexico or Korea 3 weeks earlier, and they expect me to fix something where I have no idea what actually happened. It's a difficult position to put your doctor locally in. Like, what happens if your eyelid isn't closing properly, or suddenly the scar looks really bad? Are you just going to hop on a plane and fly to Turkey the next day? That is a real question that you need to ask yourself before you go. Now, third, and this is the most important one, when you have a problem after facial surgery, the most important thing you can do is to start with the surgeon who operated on you, because they knew exactly what happened in that operating room. They knew what they removed, what they repositioned, what they tightened, how much tension was on the tissue. A different surgeon working on someone else's eyelid is just kind of flying blind. If your surgeon is on another continent, you've already lost that advantage before anything goes wrong. Now, one last note on pricing. We have to cover this. How does insurance work? So if it's cosmetic eyelid surgery or blepharoplasty that's done just because you're trying to minimize the signs of aging, then insurance doesn't cover it. The insurance category is called functional eyelid surgery or functional blepharoplasty. That's when the upper eyelid skin has gotten so heavy that it's actually hanging over and blocking your vision. That would mean that it would basically be blocking the colored part of your eye and cutting like the top half of your eye off or even more. If you can see the full colored part of your eye, you don't have a vision problem. But if you can't, that's a vision problem and insurance can cover it. It does require documentation and testing, and not everyone meets criteria. And sometimes patients have both a functional problem, like upper eyelid drooping, and a cosmetic one, like lower eyelid bags, at the same time. Insurance pays for the functional part. Any additional cosmetic refinement is still going to be out of pocket. Your surgeon should spell that out clearly in writing. Okay, here's the bonus tip I promised you. Before you book a blepharoplasty anywhere, ask the surgeon this. What would make you tell a patient that they are not a good candidate for this surgery? A surgeon who gives you a very specific answer, maybe something like, you have super bad dry eye, or you don't have enough skin to remove, or perhaps you just have unrealistic expectations, that's a surgeon who has really thought seriously about what they're doing and respects their own craft. A surgeon who basically says everyone qualifies has just told you something important. A willingness to say no is one of the clearest signals for surgical judgment that you'll ever get. Listen, they call it a consultation or a second opinion for a reason. You want the surgeon's opinion. You don't want them to just walk in and say, you're definitely a candidate, even if they haven't looked at you. So I'm trying to give you all this information just for free before you spend $1. That is the full picture on cost of eyelid surgery. The price matters, of course it does, but now you know it's not just a number, it's a signal, and like any signal, you have to know how to read that signal. If this video was helpful, please hit the like button. It genuinely helps my channel reach people who are trying to make good decisions about this, and you never know when you might be helping somebody else. Subscribe if you want more breakdowns on what actually happens during these procedures, what the recovery looks like, and what separates a great consultation from a bad one. I'll see you in the next video.